So I think it's interesting when you talk about investment as the opportunities that you see, investing in financial risk protection, family planning, and nutrition, and talking about health insurance. I think that brings me to Professor Sambo. Just off the back of what Martha was just saying, and looking at it from the lens of opportunities, working with the private sector, what roles do you see the public-private partnership play in advancing public health in Nigeria, or even health insurance, financial risk protection? And how can we optimize that to improve delivery, effectiveness, and coverage of health services?
In order to do justice to this question, the role of private sector in health insurance can be easily discerned if you take a scan of the health insurance ecosystem, looking at all the multiple elements that brings about health insurance. Health insurance basically is to ensure access to healthcare delivery services. And if you look at healthcare services, so many actors play a role in establishing it. Taking from the policy angle to the implementation angle. Effective public-private partnership will entails that private sector is carried along in all policy formulations where policies are being conceptualized, where policies are being translated, and at the level of implementation, where service delivery can be delivered. And if you look at the service delivery angle, you realize that private sector is responsible for almost all the commodities that are needed in healthcare facilities, ranging from physical facilities and all the commodities that are involved. And therefore, private sector can function effectively if there are enabling private healthcare facilities where people can get access and all the commodities that are therein for people to prospective enrollee of health insurance to realize. And if you look at deep into the health insurance ecosystem as being currently implemented in Nigeria, ab initio there is a huge role of private sector, because the actual link between the National Health Insurance Authority agency and the healthcare facilities and providers is what is called health maintenance organizations. These are private sector organizations, limited liability companies that are serving as financial managers to health insurance. NHIA do collect premium, transmit it to the health maintenance organization, and they in turn transmit it to the healthcare facilities. These are huge, private sector participation within the national health insurance. But in this new context of health insurance, as in line with the new act, there is some operational modification. Modification in the sense that health insurance is conveniently divided into two. The aspect that has to do with delivering of minimum healthcare package, which will be implemented directly by the health insurance agencies at the national and subnational level. Then there is clearly defined role for the health maintenance organization, which represent the private sector, to drive, number one, complementary health insurance. Anything that cannot be provided within the minimum healthcare package is regarded as supplementary. Therefore, health maintenance organization can provide that. Number two, not everybody will be compatible with minimum healthcare package. For example, even within public sector, you bring NNPC, you bring CBN, and you say that they will take minimum healthcare package when they even have opportunities to be taken outside the country to medical care. So those kind of organizations that are high flyers will invariably require supplementary health insurance. So the private and health maintenance organization can drive that. Then private health insurance. We are saying that national health insurance now is mandatory. Everybody will have to come through the minimum healthcare package, so that the underpinning principle of health insurance that has to do with pooling of massive resources can be attained. And if we operate a very fragmented social health insurance, the whole essence of health insurance is defeated. So that's why the new law is saying, come through mandatory. If you want a supplementary health insurance, you can have that opportunity through the health maintenance organization. Then another new innovative in the law that will open a frontier for the participation of private sector is the provision of third-party administrations, TPS. In the new law, there is what is called TPS. These are private sector organizations that can come and work within the health insurance space in almost all aspects. They can come with technology. They can come with skills for claims management. They can develop a call center management, which the national health insurance or state health insurance can collaborate with them to provide those services. Assuming, let me give you an example. As we are transiting from where a health insurance where HMO are solely driving the issue that has to do with authorization code. But we say for the minimum care package, HMO will not play a role. And the state will want to take that role. Can we have a third party organization, which is a private sector, that can come as a TPA to play a role in giving authorization code for the referral system? Can we have a TPA that can come and say, look, I have a skill to do claims management because this is one of the critical control knob in the operations of health insurance? Can we have a private sector that will help a particular state or will help National Health Insurance Authority to do a claims management? So the memorandum of understanding that will be signed between the two organizations under the PPP arrangement will be that I am going to provide the claims management. Can we have a private sector that will come with digital technology like call center management and say, I'm going to collaborate with a state or a particular aspect of the national health insurance to provide the call center management services so that our enrollees can have access to unfettered information, and we can even ride what we call client responsiveness within the call center. I am in a healthcare facility, I have a problem, and the problem is I can make an instantaneous call, and the call can be taken. Another area where private sector, we are working assiduously with the private sector, is the issue of NHIA drug management supply system. This is a new innovation that has been introduced by the National Health Insurance Authority. It's a situation whereby we are engaging private sector to begin to manufacture branded drugs for the National Health Insurance, so that anywhere you go, you see a branded drug. Because one of the incessant complaints within the health insurance ecosystem has to do with people being prescribed generic drug, and they are seeing generic drug as a fake drug. So if we borrow a leaf from what has happened during the Petroleum Trust Fund, whereby drugs are being branded in collaboration with the government, in this case in collaboration with the National Health Insurance Authority, we can have a private company working in collaboration with NHIA, developing those branded drugs. And there are so many advantages to be driven because of the economy of scale. The cost will come down, the availability will be assured, and the quality can easily be monitored and safeguarded. So these are areas where private sector can come. So in summary, I want to say that even at the beginning of the implementation of national health insurance by the old law, private sector has been recognized, and private sector has played a very vital role in the take-up of the health insurance up to today, and private sector will continue to participate in the operations of health insurance through the new National Health Act, either as an organ to provide commodities for the consumption in the health insurance space, or to work directly with the health insurance agencies in the area of providing private health insurance, providing complementary and supplementary health insurance, and so on and so forth. I think I will stop here.
Thank you very much, sir. Please give a round of applause. So you said a lot of interesting things, but one of the ones you said was about private health insurance, but also complementary health insurance. And I remember Martha saying something about family planning. I know that at the PHC level or in the rural areas, we have a lot of PPMVs providing support with family planning commodities. I wonder what your thoughts are around public-private partnership through these PPMVs, but ensuring that family planning commodities are available, through health insurance, if that makes sense.
Yeah, for now, at the initial stage of the implementation under the former law, we are not utilizing primary healthcare facilities. But with the advent of the Basic Healthcare Provision Fund, what we are utilizing is primary care. Primary care is quite different with primary healthcare system. Primary healthcare, if you go to UK, is basically talking about GPs in the hospital, doctors, and so on and so forth. But our own primary healthcare system have no doctors. It has healthcare workers, community health extension workers, SCHUs, JCHUs, and so on and so forth. But with the Basic Healthcare Provision Fund, the intention of the entire basic healthcare provision was to strengthen primary healthcare. That's why at the beginning of implementation of the Basic Healthcare Provision Fund, the primary healthcare facilities will serve as an entry point for a capitation receiving facilities, where it is expected that they provide minimum basic primary healthcare services function, which include maternal and child health, including family planning. So our thinking is that we want to have an integrated services. And you all know that health system and even primary healthcare advocate what is called integration, spatial integration, temporal integration, as well as as well as longitudinal integration. What is this integration? It is the primary healthcare integration is one of the key principles of primary healthcare. Integration is what it means, bringing components together into a whole. When you say a spatial integration, you are encouraging a situation whereby somebody, a man and a spouse and a child, they go to a healthcare facilities and they all receive services under the same roof. And temporal integration, you go to a healthcare facilities and you have services available at the same time, because you want to ensure that you reduce cost in travels for the rural folk who are supposed to be in the farm to get services. So at one point they can go to the same space, at one point they can go at one time they can go and get services. And it's a key principle that is often neglected. If we continue, when primary healthcare was being conceptualized in Alma-Ata, it was said that how do we ensure that the series of monovalent activities are integrated into a whole? That's why all this idea of even maternal center is not friendly with the primary healthcare system. So you have a primary healthcare system that provide comprehensive primary healthcare, 8 component of primary healthcare services, can be able to provide education concerning prevailing healthcare program, can be able to provide issue that has to do with water sanitation, issue that has to do with maternal and child and family planning, issue that has to do with control of locally endemic diseases, issues that has to do with treatment of common ailments. So we want to see a primary healthcare that is providing these integrated services, so that if you go, we can build social health insurance within that primary healthcare. But if we have a fragmented system, it will be difficult for us. And if you are insured under the health insurance and there is a minimum package including family planning, you go to primary healthcare, you can get these services through a trained healthcare providers, not really patent medical vendors. In some cases, they are just people that have no education, and they are allowed to operate, without any encumbrance in the communities, creating a lot of problems into the healthcare delivery system. So So we want to ensure that we have an organized system that can bring organized healthcare services to our team in populace.
Thank you very much, sir. Please let's give him a round of applause. Thank you, Professor Sambo.